Brother, sister, before we go any further into this list, let's be completely clear about something important. This is not a video encouraging distrust of medicine, of doctors as a profession, or of evidence-based medical care. Most physicians are genuinely skilled, genuinely caring people who entered this profession specifically to help others. But Scripture calls believers to wisdom and discernment in every area of life, including the moments when we're at our most vulnerable, sitting in an exam room, receiving news about our own health or a loved one's. Being a good patient was never meant to mean surrendering all judgment simply because the person speaking wears a white coat. Today we're naming 6 things worth paying real, genuine attention to when a doctor actually says them. Not because hearing one of these phrases means something is automatically wrong, but because each one represents a moment where genuine advocacy for yourself or someone you love actually matters. This isn't about becoming combative in a medical setting. It's about remaining a genuinely informed participant in your own care, rather than simply a passive recipient of whatever's said. Stay with me. If you've ever left an appointment feeling vaguely uneasy without being able to name exactly why, this one might explain it. Think about your own experience with medical care honestly, whether recently or years ago. Was there ever a moment where something felt slightly off in an appointment? A question brushed aside, a concern minimized, a decision that felt rushed, but you weren't quite sure whether you were being unreasonable to notice it? That instinct is worth taking seriously, even before we name the specific pattern involved, because your own sense of unease in these moments is often more reliable information than you tend to give it credit for. The first thing worth real attention is a doctor who actively discourages you from seeking a second opinion. You don't need to see anyone else about this. A second opinion would just confuse things. Genuinely confident, competent physicians rarely feel threatened by a patient wanting additional perspective, especially on anything significant: a major diagnosis, a serious procedure, an ongoing unresolved issue. Discouragement of this kind of basic diligence is worth noticing, since it protects the doctor's own authority more than it actually protects your genuine well-being. Consider what a healthy response to this same request would actually sound like in contrast. A physician, confident in their own diagnosis and recommendation, typically welcomes a second opinion, sometimes even suggesting it themselves for anything significant, because they genuinely trust that another qualified professional will likely reach a similar conclusion. Discouragement, by contrast, suggests either genuine insecurity about the recommendation or a desire to keep you from encountering information that might complicate the picture they've presented. The second thing worth real attention is a doctor who dismisses your symptoms without genuine investigation, defaulting quickly to "it's just stress" or "it's just anxiety," without actually ruling out other possibilities first. Stress and anxiety are real, and they genuinely do produce real physical symptoms. This isn't about dismissing that reality, but a pattern of defaulting immediately to this explanation, especially without any actual testing or genuine follow-up, deserves real attention, particularly for symptoms that persist or worsen over time. You know your own body better than anyone examining you for 15 minutes possibly can, and persistent, dismissed concerns deserve continued advocacy rather than simple acceptance of the first quick explanation offered. This pattern deserves particular attention because it disproportionately affects certain groups of patients, whose genuine physical concerns have historically been more likely to be attributed to psychological causes without adequate investigation first. If you find yourself returning repeatedly with the same unresolved concern, only to be offered the same dismissive explanation each time, that repetition itself is meaningful information, worth bringing directly and specifically to the conversation rather than simply accepting again. The third thing worth real attention is a doctor who guarantees a specific outcome with total certainty, offering no honest discussion of risk, uncertainty, or the genuine limits of medical knowledge. This will definitely work. There's nothing to worry about at all. Medicine, even at its very best, deals constantly in probability rather than absolute certainty, and a genuinely honest physician typically communicates that reality clearly, rather than offering false confidence simply to ease your anxiety in the moment. A pattern of unrealistic certainty is worth noticing, not because uncertainty itself is comfortable, but because informed decisions actually require an honest picture of the genuine risks and unknowns involved. Notice the specific difference between genuine reassurance and false certainty, since the two can sound remarkably similar in the moment. Genuine reassurance might sound like, "Based on everything I'm seeing, this looks quite treatable," though I want to be honest that no outcome is ever completely guaranteed. False certainty skips the honest qualifier entirely, offering comfort without the accompanying truthfulness that actually makes that comfort trustworthy in the first place. The fourth thing worth real attention is a doctor who pressures you to decide immediately, without giving you time to think, research, or consult trusted family members. Genuine medical emergencies do sometimes require rapid decisions, and that reality is real and important. But for the vast majority of medical decisions, genuine urgency and manufactured urgency are actually two very different things. And a pattern of pressuring quick decisions on matters that don't actually require it deserves real scrutiny. Asking directly, "How much time do I actually have to think this over?" is always a reasonable question. And how that question gets answered often reveals whether the urgency is genuine or simply a persuasion tactic. Consider the specific quality of pressure applied when urgency is manufactured rather than genuine. Manufactured urgency often relies on emotional language, subtle guilt, or a general sense that questioning the timeline itself is somehow unreasonable or uncooperative. Genuine urgency, by contrast, is usually explained with specific, concrete reasons, a particular window of effectiveness, a specific risk that increases measurably with delay, reasons a good physician can articulate clearly rather than simply asserting. The fifth thing worth real attention is a doctor who won't clearly explain why a specific test or treatment is genuinely necessary when you ask directly. "Just trust me" isn't actually an adequate answer to a reasonable, direct question about your own body and your own care. A genuinely confident physician can typically explain their reasoning in terms you can actually understand, even if the full clinical detail requires some simplification. Repeated deflection of this kind of basic question is worth noticing, since informed consent genuinely requires actual understanding, not simply passive agreement. This doesn't mean every physician needs to deliver a full medical school level explanation for every routine recommendation. Some things genuinely are simple enough not to require extensive discussion. But when you've asked a direct, specific question and received only a vague deflection in response, that gap between the question asked and the answer given is itself worth noting and worth asking again, more specifically, before simply moving forward without genuine understanding. And the sixth, maybe the most important of all, a doctor who has an undisclosed financial interest in the specific product, device, or procedure they're recommending, without transparently explaining that connection or presenting genuine alternatives. This doesn't mean every recommendation from a doctor with any industry connection is automatically suspect. Many genuine advances in medicine come from exactly this kind of collaboration. But transparency matters enormously here. A doctor genuinely serving your interests will typically disclose relevant connections and present real alternatives, rather than simply steering you toward whatever happens to benefit them financially without you ever knowing that motive existed. A simple, direct question can often reveal a great deal here. Are there other options I should genuinely consider? And do you have any specific connection to the company or product you're recommending? Most physicians will answer this honestly and without defensiveness, since the question itself is entirely reasonable. A defensive or evasive response to this straightforward question is itself meaningful information, regardless of what the actual answer eventually turns out to be. So what does it actually look like to remain a genuinely wise, informed patient without becoming needlessly distrustful of medical care itself? It looks like feeling free to seek a second opinion whenever something significant is at stake. It looks like continuing to advocate for yourself when symptoms are dismissed too quickly. It looks like expecting honest discussion of risk and uncertainty rather than false certainty. It looks like asking directly how much time you genuinely have before a decision must be made. It looks like expecting clear answers to reasonable questions about your own care. And it looks like asking directly about any financial interest shaping a specific recommendation. None of this means treating every doctor with suspicion or assuming bad faith in a profession genuinely built around helping people. Most physicians deserve and have earned real trust. But genuine trust and genuine discernment were never actually opposites. And Scripture's call to wisdom applies just as directly inside an exam room as it does anywhere else in life. Here's a simple diagnostic for each of these 6 patterns. If you want somewhere concrete to start applying this the next time you're in an exam room. For discouraging second opinions, was your request for additional perspective met with genuine support? or with subtle pressure to simply trust the original recommendation without further checking. For dismissed symptoms, has your concern actually been investigated with appropriate testing? Or has the same explanation simply been repeated without any real follow-up? For false certainty, did your doctor mention any actual risks or uncertainties? Or did the conversation feel entirely reassuring without a single honest caveat? For manufactured urgency, when you asked how much time you genuinely had to decide, did you receive a specific, concrete reason, or simply a vague sense of pressure? For unexplained recommendations, can you actually articulate, right now, why a specific test or treatment was recommended? Or would you mostly be guessing? For undisclosed financial interest, have you ever directly asked about a specific financial connection to a recommended product or procedure? And if so, how was that question actually received? None of these questions are meant to turn every doctor's visit into an adversarial interrogation, or to suggest that healthy medical relationships require constant suspicion. The vast majority of physicians are genuinely committed to your well-being, and most medical recommendations, most of the time, are exactly what they appear to be: genuine, well-intentioned guidance from someone trained specifically to help you. The goal isn't distrust. It's simply remaining an actively engaged, informed participant in decisions about your own body and your own health. Consider how differently medical relationships function when patients approach them with this kind of engaged wisdom, compared to a purely passive posture that simply accepts whatever's said without genuine engagement. Genuinely good physicians actually welcome engaged, informed patients, because that engagement typically produces better outcomes and a stronger, more trusting relationship over time. A doctor who responds poorly to reasonable questions, reasonable requests for second opinions, or reasonable requests for clearer explanation is revealing something worth taking seriously about the nature of that specific relationship. Scripture's call to wisdom was never meant to exempt any area of life, including the deeply vulnerable moments spent in a doctor's office, discussing your own body or the body of someone you love. Genuine faith and genuine medical wisdom were never actually in competition with each other. Trusting God with your health has always coexisted comfortably with the responsibility to actually think clearly, ask good questions, and remain a genuinely engaged advocate for your own well-being and the well-being of those you love. If this stirred something in you, brother, sister, don't scroll past it. Subscribe to Biblical Warning now, and let's keep examining these hidden places together, one warning at a time.